just thrown out a bunch of things, some of which resonated because we were already on our way in some of these areas, and some of which were very challenging. And each person in this room probably had a different sense of that. So I invite all of our current or former medical students and medical educators to please opine and, ask a question, make a comment. This is a rare opportunity over here.
I'd like to comment. I'm Adi Haramanti from Georgetown, a dear friend of Rick Vari's and also a dear friend of Professor Harden. And I very much appreciate your comments and thoughts and the provocative nature of what you said. I have a comment and a question. My comment is, I absolutely agree with you that we need to engage our students more. And in fact, just to relate a personal experience, when the pandemic hit, and all of us were trying to grapple with how best to teach in a virtual environment, I didn't know what was the best way. And every day I polled my students. I actually had a poll to invite them to tell me, what can I do to optimize your learning? I'm not going to take lectures and either have you see these videos or talk faster or throw exams or problems at you, but you tell me what's working for you. And of course, there was no consensus on things. But I agree with you that we need to poll the students, but that leads me to my question. My question is that I think each school in the United States, we have 157 schools now, is developing curricula that I feel are completely disjointed from where the students are studying. In other words, the students have a way that they're approaching their learning, and we're sitting on curriculum committees with student reps, developing curricula, and I think we have a complete mismatch. The curricula that we're developing doesn't relate to the way the students are learning. And it manifests in the lack of attendance in classes, even when they're flipped. It manifests in the lack of preparation. I don't know what the answer is, but I'm hoping you might.
And thank you, Dr. Harbody. If I might add what was going to be my question to yours, because I think they're all part of the same, which is that here at BTC, we consider ourselves to be an innovative laboratory for trying to advance many of the concepts that you've outlined today. And we've come up against this kind of challenge that Dr. Harmati speaks about, because not sure how coordinated this all is in the UK, but here in the USA, there is not a coordinated effort, although they're trying, in terms of the conceptual framework we use for the MD degree program, the residency and fellowship programs, and the licensure of physicians. And as a result of that, there can be challenges in innovating curricula. We wonder, as knowledge is sampled for multiple choice examinations, whether the sampling that the authorities use for licensure or for board certification, whether that is going to evolve in a way that makes it easier for the learners to both understand what's expected on the test, to do well on the test, and also come along with us in this collaborative model of teaching and learning together. To us right now, until we see some of the examinations changing, it becomes a challenge for us as well, which gets also to what Dr. Harmati's speaking about. So anything you might have to say about that topic?
I think these are great and important points. I mean, I think, as Adi said, students have a real role, and this came probably to the fore at the time of COVID and following it, where much of the changes before and since then have been led by students. So it's very important. But the notion about, I suppose, both your comments really was the challenge I had up there in the future about the authentic curriculum and authentic assessment. And really the challenge is, are we helping our students to become better doctors? Everything we do or decide in the committees, because that's our aim, surely. And not only to be better doctors, but to help the community. I mean, we're in the education game, but really we're in the health improvement game. I think our challenge is, are we going to improve the health of the populations in our region or in our country? And is our education program going to contribute to that? Just a small anecdote, because I think it is relevant, is one of the countries with most participants in the AME conference is Thailand. And I think we had about 300 people from the States at the last meeting, but we had 450 from Thailand. And the Minister of Health came along to the meeting. And I said to him, why are you sending all these students? Because he said, look, in my country, I want to believe that we're going to improve the health of the population in Thailand. To do that, we need better doctors. To do that, we need better trained doctors. We need better teachers to train them. And we need to train these teachers. And that's why I'm sending them to the AME meeting, maybe rather optimistic, but nonetheless, the notion that really our ultimate aim, all of us, I hope, is to improve the health of the communities we're working in. And that what we can do is our curriculum contributing to that? Are we going to be training better doctors? So it is an important asset, but a challenging one. And just the last point about how do we do this in students? I think many of the changes that are taking place have been in the past have been prompted by students, driven by students. The International Federation for Medical Students Association, I don't know if they've got a branch here in Roanoke, but they've got over 1,000 members over the world. And they've been bringing about quite significant changes in medical schools, arguing for more social responsibility, for example, of medical schools. So the students have been having a very powerful voice now, politically and otherwise, in education. So I think students can help drive these changes we're all hoping will happen. But thanks for these comments.
Scholarship, I see that here. We have students on, I think, all of our committees. We have students as members of TEACH, students who are attending our sessions, who are, we have some students on our posters this evening. So they're becoming more and more interested in their own education and wanting to see a difference and change. So.
Excellent. So you're at least at step 5 in the ladder.
Implied throughout your different models are the ideas that deep and critical thinking is absolutely essential on both the teacher side as well as the student side. That means self-reflection is required and is necessary. And simultaneously, we're all living through a time period where faster access to answers is available, as you mentioned, at our fingertips. And through AI often, and through, through this little device, I can get any answer very quickly. And I can even write an entire paper very quickly by the time this lecture is over. But authenticity and trust are often slow processes. And so I wondered if you might reflect on that kind of convergence of two really different speeds of how people are interacting, teachers and students.
Now, a great question. It's slightly off issue, but it's partly the answer. There's an interesting paper by Diane Wayne, who's an emergency physician in Chicago. And she was saying that before training emergency physicians, which was her job, I just simply knew what knowledge and skills and practical procedures they all had to do. But during COVID, I suddenly something was different. Because what I wanted them really to think back and reflect on what they were doing, think about it, and to show empathy to the attitudes and even kindness. So, but most of all, reflection. So she wanted this as part of the thinking on the training program in future for emergency physicians. But how do we incorporate into our curriculum more generally? I think there are different strategies. And one I think we found in Dundee is that was helped was the moving the final assessment. And I know we have the luxury of not a final national exam, so we set our own exams, and to make the boat of it being the portfolio. So it's a portfolio assessment. So we, from day one of medical school, when I was dean, I met the students in the day one, and I said, look, these are the learning domains, the outcomes, and we've got 10 learning domains in the Scottish Doctor. Not too dissimilar from the ACMG competencies or whatever. These are domains. And what you have to do by the time you graduate 5 years from now is demonstrate in your portfolio, which you have to keep, that you've achieved each of these domains, the level required. So the students have got to reflect all the time what they're doing, what's standing awake, doing a practical, meeting patients in their home. How is that contributing to these different domains? And at the end of the final year, they're judged pass, fail in the final exam on this portfolio that they produce and present to the examiners. And I wanted the 2 stages in that process. We were thinking, let's abolish, for those who we read these portfolios and they're excellent, we don't need them to meet them. The 4 examiners meet them. One always a basic scientist, one from community, a surgical specialty, medical specialty, and discuss the portfolio with the ones. But for those who are clearly obvious, we don't want them to do this. And the first time ever, the student have said, no, we don't want to change that process. We want to present our portfolio. Because they saw this as, they were pride in this. This is what I've been doing for the last few years. I'm now going to be a good doctor, and I now know I've achieved all these, and let me show you how good I've been. And it was interesting, but that's just one of the ways. I think that the main thing, however, is to recognize by the committees that self-reflection and this sort of process is part of the curriculum. It's to be built into the program and not an add-on extra.
I think we're starting some great conversations. Dr. Wicker, who's next?
I had the unique experience of, I've actually completed 2 residencies. First finished family medicine and then went back and finished internal medicine after that, so I could pursue a career in critical care, and then also outpatient clinical. Love this topic. I've been involved in medical education. Just give you my background all the way since my master's. I was a part of the academic curriculum committees. We voiced our opinions as students, like, this is what's working, this is what's not working. How do we improve? And so I'm wondering, from your role from abroad, what have you seen worked? Because I'd say 60 to 70% of the time, and I'm in this transition of becoming a learner to a teacher, which is what drove me to join Teach. As a learner, when I was in my master's program, my medical school program, we would offer up suggestions. And of course, you're naive at the time. You don't know what it is to be a physician. You don't know all the answers, but we were met with more no's. This is the way it is, and this is how it's always been. And so I'm wondering, what have you seen actually worked? Because we could advocate as students, we could have these, I'm at a loss for the word, but this kind of social position on the academic curriculum committee, but without change. So I'm wondering, it's great to start this conversation, but what have you seen work from a student advocating to the education side of the system that actually invoked change? And I'm still running into this problem now as a fellow. We'll come up with suggestions as the critical care fellows how to improve our unit, and we're met with, well, this is the way that Carillion runs it. And so I'm trying to do my best to keep education, improving and changing, but I'm still running into roadblocks where, as the student, we feel as if our ideas are not being heard to the authenticity that they should be.
Yeah. I mean, a great question, and brings it back to the practicalities, and the reality is what I've been talking about, simply science fiction, or is this all possible? And I think one answer is, and it goes back to many of the other challenges in medical education. Should you have integration or not, or should you have problem-based learning or not? And the answer was always one way or other. People would ask me, should you have OSCEs? They always ask me, is that the best form of treatment, of assessment or not? And I think that's the wrong way of approaching it. And it's a wrong way of approaching this as well. The argument, should students be partners or not in the education, or is it the role of teachers? Back to the quotation from Harden, teachers are there to teach, students are there to learn. That's the hierarchy we're all committed to. And I think one way of shattering is not, where are you for this partnership or you're against it? But my argument is, where do you want to be in the ladder? And if you look at the ladder, both the two ends are untenable. No one would want the students to take complete control, although there's a few examples where they have, but that's not really tenable. At the bottom end, I think the arguments for not involving students are just so extreme that that's not tenable. So the question is, where do you want to be in that ladder? And if that's the starting point for the discussion, then I think you can genuine discussion point within your curriculum committees and other bodies. Where do you want to be in that ladder? And it's a much, rather than polarizing the opinion, are you for or against students? And I see that from the student perspective, as well as from the staff perspective. Let the students say where they want to be in that ladder, and the staff where they want to be in that ladder, junior staff and the professors. We had separate meetings between the professors and the other staff, because we didn't want one dominating the other, and separate meetings with the students. So see, where do you want to be? Because it's not polarizing the opinion. And I think then you can make progress.
Thank you for that question and for that response, Dr. Harden. Your response to me tells me not to think about if the students will be involved, but how. Because without any attention, we know how. They'll be reading their blueprints instead of the materials that we curate for them in their learning. So great question and prompted a wonderful beginning of thinking. Also, the other thing is the power of ideas. I appreciate the frustration that until we've made this sea change across all of the accrediting bodies and initialed organizations in academic medicine, it is hard to bring everyone along. The power of ideas may have stimulated everyone in this room, but not everyone's in this room right now. So this is where we try to use identify thought leaders within specialties and within accrediting bodies to get to learn more about this. And over time, we already have seen in the course of I was used to say my brief career. We've seen some change already in the last 40 years or so, and we just need to keep moving in that direction so that those that don't come along from the ideas will come along from the necessity of it. That's my somewhat cynical point of view, unfortunately. Dr. LeConte has a question.
Thank you. Fabulous talk and really exciting to hear the ideas that we've been thinking about overlap so much with what you're discussing. As you talk about portfolios to assess learners at the end of maybe the first part of their medical training, how do you think about assessing throughout the continuum? Because the changes that we're talking about are ultimately to create physicians who are practicing in the way that we envision to improve healthcare. But how do we know as educators here that we're doing the right thing where the outcomes are going to be 10, 15, 20 years down the line potentially?
Yeah, another great question. I think we were worried about the continuum. We were talking some fascinating conversations earlier this morning about the need to look again at the continuum of education, undergraduate, postgraduate, CPD. And one of the things with the portfolio was we were worried that it stopped. So I was describing the use of the portfolios in Dundee for the final examination that students, and then they qualified, went into the postgraduate training programs. And we were worried about the continuum and things changing. And the schools tend to be using different platforms for their portfolios. So we agreed a common platform, and the colleges agreed a common platform for the postgraduate training portfolio as well. So the students continued were told this portfolio, because it's a learning tool for them, so that they can revise from it, remind themselves from it. The same portfolio was continued and used partly of the assessment in postgraduate training afterwards. So I think that is a very important point you're making about the continuum. And I think the notion of portfolio is just one small thing one can do to actually make the continuum a reality.
Well, I wish we had a bunch more time, but we unfortunately have to wrap up at this point. And I just wanted to thank Dr. Harden for stimulating a wonderful conversation through just a wonderfully crafted presentation. I love the music. I love the comedy throughout there. It was a lot of fun. But we end on this somewhat more serious note in honoring your participation as the Richard C. Vari Endowed Lecturer. We have the certificate signed by me as Dean and Dr. Wicker as the head of our Teach Academy. With our deepest gratitude. Thank you so very much.